Your NCLEX test plan will have questions that are written to address the following: your level of cognitive ability, client needs, and integrated ability. In the test plan for the NCLEX, beginning in April 2010, the NCSBN identified a test plan framework that was based on client needs. 4 major categories have been included in this test plan. They are safe and effective care environment, health promotion and maintenance, psychosocial integrity, and physiological integrity. There's 2 subcategories under the safe and effective care environment. One of them is management of care, which is 16 to 22% of the questions that are asked on the test, and the other one is safety and infection control, which are 8 to 14% of those questions. You will need to know the components of the nursing process when taking the NCLEX, because some of the questions asked will be asking for a component of the nursing process. For example, a question could be looking for an assessment answer rather than an implementation answer. So if you look at the components, it's assessment, diagnosis, planning, implementation, or nursing interventions, and evaluation. Included in your assessment would be the health history, and that's conducted to determine a person's state of wellness or illness. It is a planned interview, and you need to establish a state of mutual trust and respect when you're working with your patients. Physical assessment may be done before, during, or after the health history is gotten, whichever way is more comfortable for you. The purpose of the assessment is to identify those aspects of the patient's physical, psychological, and emotional state to indicate what you need to do. Other components can be obtained from family or significant others or other members of the healthcare team. And all information is recorded in your patient permanent record. It serves as your legal and your business record for a healthcare agency. It's also the basis for evaluating the quality and the appropriateness of care, and provides data that are useful for research, education, and short and long-term goal planning. Nursing diagnoses are not a medical diagnosis. They are statements made about the patient problem that guides the nurse in the development of the nursing plan of care. For example, a patient with respiratory problems like pneumonia, you would probably give a diagnosis like activity intolerance, airway clearance ineffective. That is what your nursing diagnosis would look like. It wouldn't be pneumonia. Collaborative problems are your physiologic complications that nurses monitor to detect changes in status or onset of complications. These are usually related to the disease process, treatments, medications, or the diagnostic studies. The nurse will recommend nursing interventions that are appropriate for managing the complications and implements the treatments prescribed by the physician. Both nursing diagnoses and your collaborative problems are recorded on the plan of your nursing care. Planning is one of the components of the nursing process. It's development of goals and outcomes to assist the patient in resolving the diagnosed problem. So you will also assign priorities, and that's done as a joint effort by the nurse and the patient and family members. You make sure that when you're assigning these, that you do include all these folks, because it's real important they're in there. Maslow's hierarchy of needs provides a useful framework for setting priorities in patient care. And setting priorities are also the types of question you'll be asked when taking your NCLEX. I have on your screen Maslow's hierarchy of needs, and it shows how a person moves from fulfillment of basic needs, which are your physiologic, to your higher levels of needs with the ultimate goal of physiological health and well-being. Level of cognitive ability requires that the nurse utilize critical thinking and decision making. The NCLEX test is written at an application level or a higher level of cognitive ability. And here's how to apply your cognitive ability. A nurse has an IV going. The nurse sees that there's blanching, coolness, and edema at the IV site. What action should you take? So your assessment findings tell you that something is wrong with the IV site, and you should know that probably the patient has infiltration. And then from there, what are you going to do? Should you DC the IV? Should you apply a warm compress? Should you check for a blood return? or measure the area for infiltration. What's your best answer? Well, infiltration is damaging to the surrounding tissues, so of course you're going to DC that IV. And then after that, you're going to take care of the damage that the infiltration caused. Regulation of nursing. Let's talk about the standard of care. If the standard of care is that vital signs will be taken when a patient arrives after surgery, and 1 hour times 4 hours after surgery, and then Q2 hours times 4 hours, then routinely, the nurse is expected to do that. She's held to that standard. If something happens to your patient, and it can be proven that she did not take vital signs when they were due, and whatever happened to the patient could be avoided if the vital signs had been taken, the nurse can be disciplined for a practice violation. The nurse can be named as a defendant in a malpractice lawsuit, and she can also be disciplined by her board of nursing. So if you're taking care of a patient, say on the postpartum floor, and they come to you right after they've had their baby, and you're supposed to be taking vital signs, say, every 15 minutes times 4, so you'd be taking vital signs every 15 minutes in 1 hour. If you decide, well, I'm busy doing something else, and you don't do that, and that lady starts bleeding out, and they can show that you did not take those vital signs, then you are in violation of the Practice Act because you're giving unsafe care. And you can be reported to the board. And if something really bad happens to your patient, you can be a defendant in your malpractice lawsuits and disciplined by the board. Respondent superior, the employer. Now we're going to talk about leadership, delegation, and prioritization of client care. Your nursing roles in this would be promote health and prevent illness, provide comfort and care, make decisions, serve as a patient advocate, lead and manage health care teams. That's what we can do best. We also, in nursing, need to communicate effectively. We educate clients, families, and communities and other health providers, and we act as a resource person, and we are also a discharge planner. Professional responsibilities would include your accountability responsibility, your leadership, your management, your delegation, and of course prioritizing your patient care. So accountability and responsibility. You are responsible for what you do and accountable for the outcome of your actions. Leadership involves the influence of others to achieve goals of patient care or whatever the team is doing. Management means the accomplishment of tasks and goals by you or other nurses directing others to do the tasks. And then, of course, delegation is when you transfer a task to someone else who's competent and qualified to do the tasks. And then the nurse that's doing the delegation is still responsible and accountable for the outcome. So if I ask someone else to, say, put a Foley catheter into a patient, I need to make sure that I'm getting someone competent to do that, and I need to make sure it's within their scope of practice, and I need to know that I am still responsible to making sure that that action or that procedure was done. Just because I ask someone else to do that for me doesn't mean that all of a sudden I don't have any responsibility for that. I'm responsible because I'm the one that delegated that procedure out to someone. Okay? I am also responsible if I delegate. Like I mentioned, I am responsible to make sure that it's within someone's scope of practice. Just because someone tells me they can do something, I need to make sure that they legally can do that and that they know how to do that. So sometimes you will want to delegate out, like catheterization can be delegated out in some facilities to the nursing assistants, and of course other nurses can do that. I need to make sure that they're competent to do it. Whether someone tells me or not, I'm still responsible to make sure that they're competent. Okay? Prioritization occurs when the nurse determines which needs or problems require immediate action and which ones can wait. Many questions on your test can be directed in this area. So think of a situation where you would be caring for a team of patients with various diagnoses and needs. And you've just taken a report from the off-going nurse, and she tells you that one patient needs pain meds, another patient has an NG, the patient with the NG is in stable condition, another patient is a post-op patient and they're stable, and then you have another one complaining and feeling short of breath. Who is your priority? Well, you know your priority is going to be the one with short of breath. Particularly if you're thinking of Maslow's hierarchy of needs. You know you have to be able to breathe. So you're going to go see the patient with the short of breath first. And I would be questioning the off-going nurse on why she left that patient in that condition anyway. Some of the questions that you're going to find on the NCLEX regarding nutrition could be found in the areas of patient diagnoses, specific requirements or restrictions ordered for treatment of the disorder, therapeutic diets such as your low salt, low sodium diets, carbohydrate diets for diabetics. You can also be looking at questions that deal with nutrients that are contained in food and supplemental or enteral feedings.